think first and foremost, we have seen that the U.S. healthcare system is strong, especially the ICU capacity is really second to none in the world. Most importantly, I think we've all seen what a great healthcare workforce we have here, and I think this is maybe the moment for everybody to thank their neighbors, their friends in the community who work in healthcare. But we've also seen 3 system-level failures here. What makes me angry, what makes me sad is that the crisis has really hurt the vulnerable populations the most, the poor, the elderly, people with pre-existing conditions, and that really brings everything about insurance and payment reform back on the table. Second, I think as far as national preparedness, the national stockpile, PPE, supply chains are concerned, I think there are some challenges here that we should talk about. And then third, at the kind of more cultural level, I'm kind of frustrated to see the failure of society to believe in science, believing in clinical evidence. I mean, if you want to fly to the moon, you have to learn physics. And if you want to fight a virus, you have to deal with epidemiology. And this is the moment for science and not the moment for wishful thinking. And I think we have to do better as a country on this. We have to really talk about, before the crisis, we have to talk about the stockpile. And let's really understand the crisis that we're in. The richest country on earth is running out of masks that cost us 70 cents to sell to a hospital, and probably in production they're costing like 30 cents or so per pop. That is embarrassing. And so it really goes to this idea of the national stockpile. I know that word sounds alarming, national stockpile. It sounds more like the Soviet Union would do this in the 20th century. There is a belief, I think, in this country that the national government cannot be trusted, that there is a belief in the free market, and there's a belief that stockpiles are no good anyway because we have lean systems, we should do things just in time. And I think we really have to understand that this is a misperception. Let's start with lean. Lean is a term that comes from the auto industry. We love to do things just in time, and modern assembly plants are running on 2-3 hours of inventory. Everything gets replenished, again, just in time, and hospitals have learned from that, for the better or for the worse. But these just-in-time systems work great, except when they don't. When you have a crisis, when you have either a disruption in supply or a surge in demand, these lean systems break down very quickly, and that means we have to buffer. We have to have a stockpile. It doesn't sound attractive, but that is the only way. And I would argue it is the government who have to have this stockpile, because the private enterprises are always going to underinvest. They will not price in the externalities that having insufficient PPE will bring to the society. This is a classic market failure, and I think there is no better enterprise, no better decision body to step in than the government to do this. Well, we hopefully have learned the lesson. I mean, this idea of a pandemic happening is not new. If you look at what Bill Gates and others have been talking about 2 or 3 years ago, that topic has been on the table. We have just made a decision to not prepare for that, right? I mean, we're spending hundreds and billions of dollars on military, but again, we're not buying a 70 cents face mask. So I hope in this really cruel way, I mean, we already have had 50,000 people losing their life in the U.S. alone. I hope we have learned the lessons from that. But I think it's going to be a long while before we're going to hit that new normal. I think we have to go through this recovery phase now. We have to talk about testing. And then one day, probably when there is a vaccine, there is indeed that new normal where we'll start learning some lessons on innovations, telehealth, some of the things that I think came up in the crisis that were kind of used as a last resort, as a crutch almost. And I think all of us have seen this, whether it's online grocery buying or other things. Some of these things, some of these innovations, I think are going to stay beyond the crisis and probably lead to happier consumers and better business. Yeah, Yeah, absolutely. If you think about the demand here, demand arises when people have unmet needs. And I think there is no time that I can remember in my life where I had more unmet needs than right now. I mean, the fact that we're spending hundreds and hundreds of billions of dollars every month to kind of deal with this crisis shows there are massive unmet needs. And so, yes, indeed, there are opportunities for innovations, there are opportunities to do new things. I think in the next year, it's probably all about dealing with infectious diseases, thinking about testing, the logistics behind testing, business models behind testing, who should pay for that, how often people are going to get tested, other forms of kind of managing population health. So those are massive new business opportunities that are calling for innovations, not only because we want to make money, but really primarily we want to innovate to kind of keep people healthy and safe. We need more than 300 million tests in the next year. And this is a really massive undertaking that is of a magnitude that really goes into the category of flying to the moon or D-Day. It's a massive logistical challenge for the country. I think digital health is going to be one of the highlights in this crisis, that a lot of kind of traditional consultation in primary care and specialty care not related to corona has moved through basically a delivery through a Zoom, a Blue Jeans type of conference call. And this is going to stick. I mean, I've been doing research in telehealth for now 5 years and longer. And the technology has been around for a while, but both providers and patients had these hesitations. And I think now because of the crisis, we have forced both providers and patients to use it. And now I don't think they want to go back. I mean, it's just so convenient that rather than getting to the hospital or the clinic, waiting, parking, checking in, checking out, all this stuff, easily it can add up to 2 or 3 hours for 20 minutes of care. And now clicking on a Zoom meeting, if the doctor is running late, I mean, you're just going to browse through the news and do some emails, all of that from the comfort of your home. This is going to stay, and I think we have to work out now the business cases behind it. We have to kind of agree with payers on compensation, but digital health is going to be one of the winners in this crisis. At the minimum, I think it's the delivery of telehealth. And when I say telehealth, I mean replacing traditional in-office consultation with basically video chats. That's one version of telehealth. I think the other area that I'm very hopeful that we're going to finally see things move is in terms of the wearables, in terms of sensors, in terms of devices. This is going to be the next frontier.